Okay, well, good afternoon, everyone. I appreciate being here. I'm going to introduce myself in just a minute, but first, I want to give you a little bit of history. I have been a clinical dental hygienist for 21 years in private practice in West Branch, Michigan, and then I moved into public health dentistry, and I run a mobile dental school public health program connecting people to care. But even though I'm in the schools and I work with littles, I've worked with all ages and populations, and I have a heart for our aging population and special needs. So I was excited to be here. Let's see. So here's where we all want to be. This is where we all want to be with a beautiful, healthy smile. And Sydney and I were just talking about this and all of our teeth for our entire life. And really and truly, we can all achieve this just by taking the care and the prevention that we need to do throughout our lives to make sure that we can. And we have to remember that our teeth are the gateway, our mouth is the gateway to our bodies. So it's important that we have a healthy smile for our whole life, and we will also be a healthier person as a whole. So my name is Elisa Dack. Like I said, I'm a registered dental hygienist. I run the oral health program at District Health Department number 2. My home office is West Branch. We cover Iosco, Alcona, Ogama, and Oscoda counties. And I also supervise the hearing and vision program. So school public health programs, I love it. I don't know if I'll ever go back to clinical private practice. My heart is in public health, and I love making communities healthier. My contact information is on here too, but it'll also be at the end. So I think the biggest thing that I want you to gain from this presentation is that the importance of our aging population, and this includes special needs, that we stay on top of what's happening in their mouth and just understand that that affects their whole body. So understand the oral systemic relationships. Realize what barriers we have for dental treatment for these populations in Northeast Michigan, Northern Michigan, a lot more barriers than they do in Southern Michigan. Common oral effects of medications and implementing preventative measures. Like I said before with that picture, this last slide, and their caregivers. Recognize and describe the elements of effective primary care dental collaboration. So just recognizing the signs, and we're going to talk about that. So a healthy mouth and good nutrition are key to aging well. So oral health and your body are directly connected. I really can't say that enough. If you have poor oral hygiene, you have an increased amount of bacteria in your oral cavity. That means that you're an increased risk for pneumonia. You're more likely to aspirate the bad bacteria that cause pneumonia. So think long-term care facilities and nursing homes, and look at the statistics and the data of how high their pneumonia rates are. This is exactly why. You tend to take, as we age, more medications. I mean, we just have more things going on, arthritis, and then possibly diabetes and some heart issues, and maybe, water retention. So you're on multiple medications. Well, a ton of medications have side effects, and a main side effect of most all medications is dry mouth. And if we don't have that sweet saliva that was designed to wash off the bacteria and the enzymes to clean our teeth, then we have an increased amount of bacteria, which can cause decay. Diabetes and poor oral health or periodontal disease, which starts as gum disease and then goes into periodontal disease, they go hand in hand. So think of a rope. If you're going to pull on one end, the other end is going to go with it. The studies to show how if you have diabetes that's out of control, you will tend to have periodontal disease that's out of control are just astronomical. And then the other is true too. If you have periodontal disease that's getting out of control, your sugars are going to go wacko. Um, you can obviously have weight loss with poor oral health and failure to thrive. Professionals can improve the overall health of their patients by addressing oral issues. And I think I was telling Sydney before we started, the one takeaway I want everybody to take from this. So whether you're a caregiver, whether you're a client, whoever you are in our aging population, it is important for everybody's hands to be on deck. So whether it's one of your parents that you're taking care of, or your grandparents, or your caregiver, or if you're the person themselves that's getting taken care of, everybody needs to understand that it's really important to stay on top of oral cancer checks. I would say that's number one for our aging population. And then making sure that their mouth feels okay, because remembering that it affects their whole body. So the biggest barriers, dental barriers for Northeast Michigan, and this does go for the aging population, but I'm going to say this is for all population, is our provider shortage and wait times. After the pandemic, we lost about 40% of our dental professional workforce, and that went across the country. But for Northern Michigan, we already didn't have enough, and now we have way less. Right now, for our Medicaid and Medicare clinics, the wait time is a year to a year and a half to get in. Now, if you've ever had a toothache, have you ever tried to wait a year and a half? It's not going to happen. So then people are ending up in the ER, and then they're not getting the root cause of the problem taken care of, and it's costing us more money. So that is just does not work. Transportation barriers. If you're in a facility, or maybe you're not driving anymore, maybe you have limited mobility. There's financial restraints. You know, when I was in private practice, I had a ton of my aging population clients, the good old boys, and a lot of them didn't have insurance and they just paid cash. But at some point, when things needed to be taken care of, they couldn't afford the correct treatment. So they just had the teeth taken out, but then that affects their quality of life. Increased systemic and chronic illnesses. I mean, we touched on that already, but that can really affect if you can get into the dentist. You don't feel good, you're not going anywhere. Dietary intake and polypharmacy. So obviously, this population has to deal with a lot of that. And you know, interestingly enough, in 2023, the State of Oral Health Equity in America survey, they found that 68.5 million adults lack access to dental insurance today. So this is a real thing. And then even worse for our rural areas, and we are definitely in a rural area. So, dental disease encompasses a lot of things. So, it's not just cavities and it's not just gum disease and periodontal disease. But those, I would say those are the three main things. But it's also the loss of teeth, it's edentalism, it's also poor fitting prosthesis. So, think of your partials and your dentures and that kind of thing. If they're poor fitting, that affects you, and then oral cancer detection as well. So there's just a lot of things that encompasses. I think this is a little blip from the far side. I love the far side actually, and I never really see it anymore. But the cardiologist is like, it looks like you have periodontal disease, and the elephant who's on the treadmill is like, hey, I thought you were a cardiologist, you know, not a dentist. But this is what we want. We want all hands on deck paying attention to this individual and saying, like, I think something's wrong here and this will affect all of you. We're connected from head to toe. Let's see what we can do. Starting with cavities. So, obviously you can read the risk factors, but I think with our aging population, our biggest risk factor is that people kind of think we're going to lose teeth as we age, but what one thing that does happen, and that's not entirely true by any means, but one thing that does happen is that our gums recede as we age. This does happen, and what it does is exposes the root of our tooth. So this picture that you see is a tooth where there is root exposure. Now, the top of the tooth, the crown, the outside material is called enamel, and enamel is nice and smooth like glass. But the root is made of what's called cementum, and cementum is porous. Think of Velcro, you know, something that plaque and bacteria are going to stick to. So when you have a lot of root exposure, you're going to have an increased risk of cavities, and that tends to happen the older we get. And that pretty much goes for all of us. It really does. Plus, we tend to get, you know, nothing lasts forever, so teeth break down over time. We have more dental work. Well, that means that we have more ledges and things for things to get caught under. Functional limitation, cognitive impairment, dry mouth. Dry mouth is huge. Can't say that enough. And, you know, if you are taking care of someone or you are someone who is dealing with dry mouth, talk to your doctor because there are some times, I mean, you obviously need to treat your illness or your disease with medication, but sometimes there's alternative medications that don't have the side effect of dry mouth. So it's important to communicate that and find out maybe there's an alternative and that you could make a change so that you're not dealing with this anymore. So you're not at risk for cavities. So, at high risk like that. Fermentable carbohydrates, we tend to, as we age, be more attracted to things that are snacky and sugary and maybe not such fibrous things and more proteins. So we're eating more crackers, we're eating more cookies, that kind of thing. That tends to happen. And because of that, those are the kind of things that the bacteria that cause cavities absolutely thrive and live on. And so we tend to feed the bacteria more. Um, we talked about recession and then poor oral hygiene, SES, lack of fluoride, and smoking. Periodontal disease is next. Periodontal disease in aging adults. It's very common, progressive gum infection, but it doesn't happen at overnight. This picture that you see, this is like advanced periodontal disease. I guarantee if we touch one of those front teeth that they are moving like piano keys. But it tends to happen over a long period of time. There are some forms of aggressive, like fast-acting periodontal disease, but that's kind of rare. It tends to happen over a long period of time. But this does not have to happen with regular dental checkups. And some people, they get more plaque or they're more prone to their gums getting inflamed easier. So therefore they have to get cleanings maybe 3 or 4 times a year instead of just twice a year. But it's staying on top of that and just knowing your body and knowing what you need so that we don't get to this point. And I'm not going to go through all the risk factors because you can read that, but it's more common in our aging population. And here's the oral cancer one. And this is a heavy hitter for me just because in my 21 years of practice, I found this 3 times. And it is really not that hard to diagnose oral cancer. It's a matter of paying attention. It's a matter of paying attention to changes, not only in your own body, but if you're taking care of someone, to really checking over. And we're going to talk about how to do that. So the risk factors, smoking and drinking, tobacco use, chewing tobacco. Um, Unfortunately, if you smoked and you drank and you chewed tobacco for 50 years of your life and then you decide that, you're going to quit, that's amazing, but you are at higher risk as you age for oral cancer. These are some of the more common places that oral cancer you'll tend to see it lateral border of the tongue, right on that border of the lip, either upper or lower. Tends to be lower more, but upper or lower, or your buccal, the outside of your teeth. So test your knowledge. I just want all of us to kind of think about, and I know we're talking about oral cancer, but if we think about cancer, of the broader word of cancer, what are some symptoms of cancer that we should not ignore? I mean, obviously one that comes to mind to me right away is weight loss. I mean, weight loss is always tends to be an indicator that something else is going on. Um, but we need to pay attention to all of these things, increased fatigue, trouble swallowing, a nagging cough or hoarseness, that's big. Weight loss is big. Obviously, a mass or a lump, a sore that does not heal, pain, if there's a change on something in your body, a change in a mole, a change in your skin, something like that. Unusual bleeding or discharge, if you have a change in your bowel or bladder habits or indigestion, all of a sudden, like everything you eat, you feel like you need Tums. All of those things are a red flag. Now we're going to kind of focus back on oral cancer. So signs of oral cancer, and this is something that all of us should not only be doing to ourselves, we should do this to ourselves, but when we cannot do it for ourselves anymore, that whoever's taking care of us really needs to stay on top of this. And so this is what you need to do. You need to watch for masses or pain in your lymph nodes, up underneath your chin and on the side of your neck. If you have difficulty swallowing or chewing, if you notice a change in your voice or someone's voice, or they have more hoarseness or coughing, fatigue, all of a sudden their teeth are becoming loose. In their ear, if they got ear or jaw pain, something's going on there, get that checked out. A persistent lesion or sore that doesn't heal. So these are all ways to look for oral cancer and signs to pay attention if maybe something is going on. Now, oral cancer can be oral, meaning that it is in the mouth somewhere, like the inside of the cheek, the inside of the lips, maybe on the buccal tissue or the inside of the teeth. I think I said that one already. I meant to say roof of mouth, sorry. Or it can be oropharyngeal, which means that it is the back 1/3 of the tongue. It's where your sweet little uvula hangs up if you say ah. It's kind of way in the back of the throat there and the very back of the soft palate as well. So for caretakers, grab a flashlight, have them open wide. You're checking all of these areas. Here's another picture, common sites for oral cancer. And I'm not going to read all of these because we just talked about them, but you can kind of get another view of the areas that you should be looking at. One other area too is have your client put their tongue up, or the person that you're taking care of, put their tongue up and check underneath the tongue as well. Now advanced oral cancer. And I had talked to you guys about, I've personally diagnosed oral cancer as a dental practitioner 3 times, but I would say the one time that honestly hit home for me was a client of mine that was on multiple medications, which was causing her extreme dry mouth, and she was getting sores. She was getting sores on her tongue, she was getting sores on her cheeks. And we were paying close attention to them because obviously anywhere there's cellular change, that's kind of a red flag. We knew it was from the dry mouth. We were working with her physician to see if we could change some of her medications, but she was still having just such extreme dry mouth. And then her lesions changed. They started to change. And as they changed, I noticed that she was getting spots on the buccal. And when I say buccal, it's like the cheek side of the teeth. So like right on the outside of the teeth. And there was not only lesions, but they were starting to become raised. When we sent her in for a biopsy, um, oh, sorry, Sydney. I just noticed somebody came in and I let them in the waiting room. Hello. When we sent her in for a biopsy, they diagnosed her with oral cancer. But what's crazy about oral cancer, and this is why I am adamant that you take care of everyone that you're working with and you really check for oral cancer in the ways that we're talking about today, is because it had the little spots that I was seeing underneath all of that, and it was into the bone, it was down her throat. I mean, she had to have half her mouth removed. It absolutely changed her life and ended up ending her life. And to me it was awful, and I thought, man, I thought we caught this fairly early. But looking back, now that I've practiced for so many years, I think at the very first signs of even seeing a few things on her tongue, even then, like if that was my mom, like I'd be like, okay, we're gonna get this checked out right now, just right now. So that's why it's just so important. I know we caught it at the stage that we could have caught it at, but by the same token, I just really think we need to just really stay on top of anything before it gets to something like this. Another factor of dental disease, edentulosum, loss of your teeth. So extraction of teeth. You can't eat as properly. You're just not talking as well. It lowers your self-esteem. It impacts cognitive status. It lessens quality of life. Sometimes you decide to be socially isolated because you don't have teeth and you don't want to smile. Who can blame you? Risk factors for loss of teeth, oral health literacy, race, access and utilization of dental services. Yeah, not good in Northern Michigan. Sensory impairment impacting daily self-care, limited finance research, and periodontal disease. But advanced age is not a risk factor. You can and you should have healthy teeth for all of your life. You should have healthy teeth for all of your life. Just because you're aging doesn't mean you're losing teeth by any means. So if you're able to stay on top of your appointments and you're able to make sure that you're paying attention to what's going on in your mouth or having someone help you with that, then you should have a healthy smile, until we no longer grace this earth. Prosthesis concerns for the dental professional. So dentures, I mean, sure, you have teeth and you can smile now, but they're not perfect by any means. I mean, they're plastic. stuff sticks to plastic. So we tend to have more bacteria in our mouth because they're rougher. And that can cause for, bacterial and fungal growth. And speaking of that, one of the things that I meant to mention under the dental disease is that Candida albicans. I mean, we tend to get more yeast infections in the mouth as we age. A lot of that comes from multiple medications, dry mouth, that kind of thing. But when you have prosthesis, we tend to have more yeast infections in our mouth as well. And then we can ingest that bacteria and cause pneumonia, gastrointestinal infections, and we can get traumatic ulcers to ill-fitting dentures. When we are missing teeth, your bone shrinks back. I'm sure many of you know, like if you've seen somebody without their teeth, when we lose our facial structure, we lose our bone. And so we have to have our dentures fitted every so often. They're going to have to realign them and they're going to have to do things to them so they fit as you change. The dentures don't change, but you change. So if those aren't getting fitted properly and you're not going in the way you should, then you're going to have issues there. So let's talk about a framework of success to make sure that we have a beautiful smile for the rest of our life. So making sure that we're staying on top of assessment of these factors. We want to make sure that behavioral, psychosocial, oral, and physical, remember, we are head to toe connected. So we want to make sure that everything is working as it should. Make sure that you're identifying risk factors for chronic systemic and oral disease. Have communication with your patients, with your clients, with caregivers, the interdisciplinary. I mean, we want to make sure that we're all taking care of that one person if they can't take care of themselves, or if you're that person that you're talking to everybody about what's going on. And we're going to be patient-centered and then have a follow-up plan. When you're doing an oral health assessment, remember that we're monitoring a lot of things: oral cancer, periodontal disease, missing teeth, what's happening there, cavities. So you're going to look at the lips, the tongue, the gums, and the tissues, saliva, natural teeth, dentures, the oral cleanliness, and dental pain. Sydney, you brought up taking care of, the preventative, the hygiene for our aging population. It's super important, brushing twice a day. Super important. Sometimes three times a day. If you've got dry mouth, you probably better be brushing a little bit more often. And it's important to floss. Remember, we've got the receding gums, so grab those flossers. And if somebody can't floss for themselves, then floss for them. It is best to floss at night. We don't want to go to sleep with that bacteria in our mouth, so it is best to floss at night. So staying on top of that for our clients or for ourselves is super duper important. Improving prognosis of oral cancer, risk reduction, early detection, diagnosis, and staging of oral cancer. Like I said, if you're going to take home one thing from this presentation, it's those oral cancer checks. Super important. And then primary care and dental collaboration. So we need to talk. Our healthcare providers and your dental provider need to be one team taking care of that person. So they need to know what's going on in the mouth. And so the dental providers need to communicate that. And then the same thing for the healthcare providers. They need to communicate that to us too. And we're in 2025 and this still doesn't happen. Still doesn't happen. It's like the mouth has been taken out and separated. Same time, the same thing with the eyes sometimes. So we just have to remember that that's super important to do, that, the healthcare providers encourage your doctor, hey, take a look in my mouth. I haven't been able to get into the dentist. It's hard to get in. Can you take a look around and do a screening? They should be able to do that, no problem. Community-based education, oral health literature, media involvement, and professional organizations. These are all of these things. So your organization, the Area 9, the aging agency, that's super important to talk to other organizations, and like we can all work together to make sure that our population is well taken care of, our aging population and our special needs. Okay, I guess that's it. I just want to leave you with this picture again, even though it was in the beginning, and just say that would be an amazing thing if everyone can have all of their teeth and healthy for a lifetime, and that's what we want. All right, thank you so much.
Thank you, Elissa. I'm gonna stop recording.